Hello, hello, everyone. I know it's been a long week. I know that there's been a lot going on. I know the stress levels have been extremely high. And that's why I wanted to present something to you guys that may help ease a little bit of the tension. Okay. So we're going to go ahead and jump in. Let me share my screen with you so you can see what it is that we're going to be going over today. If any of you received the notice about the webinar through a third party and it wasn't through me, then you probably don't have my email address. So if you would log into or go onto my website, there's a place where you can subscribe if you're interested in joining my email list, because there's always something that we'll have going on, and some information that you may want to be privy to. So you may want to join that group, okay? And that's going to be my subscribers, my email list. All right, so COVID-19, the household name right now, right? So today, a little bit about myself. I work for childcare licensing. That's where I made my way to this side of the profession, is that I was a childcare licensing inspector for almost 8 years before I branched off and started my own company, which is Ross-Haywood Training and Consulting. And I pretty much do the same things. It's just a different perspective, but I still focus on standards. And that's something different about what I do. All my trainings, all my consulting, it's all standard based. There's a lot of trainers and consultants out there. So you get plenty of knowledge from them with those other topics, child development and things like that, which are equally important. But I realized that there was a lacking in the subject matter of standards. So that's what I focus on. Okay. So we also have our expert guest here. Chioma already introduced herself in her comments. I don't know if she wanted to say a little bit more about, her way by which she came to be here with us today.
Sure. Thank you for giving me the platform. Hi, everybody. I'm Chioma Johnson, and I work with Anitra. We were in the same unit, actually. So we've gone a long time with each other, and she taught me a lot just about the grace that's offered in with providers and just working closely with them. So I'm not shocked at how well she excels on this side of keeping our kids safe. So I was an inspector. I also did abuse neglect investigation, and then I was an abuse neglect supervisor. And now I am in our training division, training our new supervisors and developing curriculum for our existing management staff, and just ensuring that they are leading with grace and leading our inspectors to ensure that the relationships that we have with you all are exceptional.
Good. So the supervisor's trainer, wow, yes. What a title, right? I think Shantae is on. I don't know if she's able to introduce herself right now. If you are, you can jump in at any moment. I'm just going to start introducing you. So Shantae also works for childcare licensing, and she'll see if she wants to introduce herself.
Okay.
Oh, there you are.
So my name is Shantae Pascaskill, and like Anitra said, I'm a licensed supervisor. I was a licensing inspector for 8 years before I became a supervisor, and I've been doing this for 5 years. So I was an inspector in many parts of town, and so I have a lot of knowledge and experience with a wide variety of daycares.
Good. So the way the training is going to go, I'm pretty much going to host the training. I've given Chioma and Shantae the platform to speak up whenever they feel like there's a need. If they want to give you additional information, they want to piggyback on something that I've said, or maybe even, correct me on some things. We've trained together several times when we were working for licensing, so it kind of flows. And I don't mind being corrected, because I want to make sure that I give you guys the most accurate information that I can. Okay. So let's jump right in. So at least all daycare centers and daycare homes who have an email on file with childcare licensing have received a notice through email about from the Health and Human Services Department about COVID-19, right? And the letter was entitled Guidance to Childcare Providers. The reason why this letter, and hopefully everybody has seen it and is looking at it and studying it, because what this letter did was it gave childcare facilities rules that they'll have to follow, new requirements during the COVID-19 pandemic. I hate that word, but that's what they're using, so that's what I'm going to use, right? So make sure that you guys have looked through this letter, read it, and you're using it on a day-to-day basis as long as this is going on in our area, okay, or in your area. All right, so some of the talking points from the letter was that you have to now prohibit visitors from entering your child care center. So what does that mean? So only select people are allowed to enter your establishment. That's your staff, any authorities like the police officers, anyone with legal authority to be there. Child care licensing staff, or it's called the child care regulatory staff now. DFPS, which is maybe CPS or someone from the other part of the child protective area of the state. Any kind of professional providing child services, like maybe there may be speech therapy or something, they may still be coming out. So if that's your normal person that comes out to provide those services, they're allowed to be in the facility. Any children enrolled, and then any parents of children who are present at that time, right? So that means if the child isn't there, the parent shouldn't come in, because that's how we're going to limit the visitors from being in the center who don't need to be there, or in the operation who don't necessarily need to be there. And at least by this time, at least for all of our daycare owners and directors, you should at least have some kind of signage outside of your building. It says something along these lines: we're currently enforcing limited access to our building due to the COVID-19 pandemic. Call this number for permission to enter. Okay. You will detour any kind of visitors who may be coming in to solicit, because they know that they can't just come in, that they have to call you to get permission to come in. And then for anybody who does call you, you want to make sure that they meet the requirement as any of those staff listed above to be there before you allow them to come in. Okay. All right. So the next talking point is screen everyone. Okay. I came up with this little method that may help you guys remember what you're supposed to do, and that's the TWA method. Screening everyone means you take temperatures, you look for warning signs, and you ask questions. No one is more important than the other. You have to do them all to everyone, every time, who has permission to be in your building. And remember, those people with that permission, we talked about already on the previous slide, and those are the only people. So yes, if someone from the child care licensing staff comes in to do an inspection, you have to do the TWA method: temperature, warning signs, and ask questions. Okay, they already expect it, right, guys? You know that if you go there, they're going to require you to do these things, so you already expect it. Now, no one can enter your center if they have a temperature of 100.4 degrees Fahrenheit or higher. Okay, no fevers. Look for any other signs of respiratory infection. If they're coughing or sneezing, coughing or having shortness of breath, sore throat. If they have some kind of temperature or low fever, they can't come in. Okay. If in the past 14 days, anyone who tries to come in or who is allowed to come in has been in contact with someone who has been tested positive for COVID-19, or they're being investigated for, like if maybe it's been reported that someone in their family or they were around somebody who had tested positive for it, they cannot come in the building, okay? Or if they have a respiratory illness. Same thing for if they've traveled internationally to an area where there has been reports of community transmission, they cannot be in your facility if they've traveled to those places within the last 14 days, okay? So how do you go about making sure that you follow these rules, follow these steps? For the first part is temperature. If you see my little picture up at the top, usually when I go to daycare centers to check their safety section and I check their first aid kits to make sure that they're complete, I usually see this standard thermometer. It's fine. It's according to the standards. It's okay to have. But you have to use those sleeves when you take temperature on everyone. Now, if you think about how many people you'd have to take the temperature of, you're going to need a bulk or a bundle of those sleeves, right? We were discussing earlier, I think there's been a shortage or an issue with finding those sleeves to those thermometers. Chioma suggested a thermometer that you're familiar with or that you've seen in use.
Yeah, so at my daughter's daycare, which I have a 3-year-old, you know, in daycare, and they've been asking me questions as well. I'm just trying to keep them encouraged and having them ensuring that they're following the guidelines that HHS has put out. But they are using a digital thermometer that doesn't even touch the face. It just scans the forehead. So it never touches the face. It never has skin contact. It just scans the forehead. You just come in close proximity to it, and then it reads the temperature immediately. So they're not using a guard. But that may be out Monday when I go, well, maybe Tuesday when I go up there, I'll double check, and Anitra, I can email that information to you.
Okay.
A link to the thermometer, so that way you could share
Oh yeah.
others.
Okay, good. And that way, because I think that's a great one to use right now, especially since we're practicing social distance, I think it's called, the new term. Since we're practicing that, not touching each other, I think that would be a great way, a great thermometer to have. So when she sends me that information, anyone who I have your email address, I will forward that information on to you. Okay. So what else will you have to do? You'll need to make some sort of check sheet or checklist. Okay. What is going to be included in your checklist? Every single thing that's listed from the letter that I've listed right here in these bullet points, right? Write it down, make a check sheet for it, because that's the only way that you'll remember everything that you need to check for. That's the only way that you'll be able to keep documentation, or accurate documentation, that you checked everything that you're supposed to check before someone comes into your child care facility. Okay, you want to cover yourself, not only with the paperwork and with the, the rules and the regulation, but also from COVID-19. You want to make sure that your facility is not ground zero, right? For any reports. For some of you who are familiar with me, I do not like to see my daycare centers on the news. And yes, I say my daycare centers because I feel like once I've invested in you, that we're all family. We all have the same goal in mind, and we're all doing this together. So I don't like to see any of my daycare centers on the news unless it's for something great. And then I'll even come and, wave in the background. So that's where I stand with that. So make your checklist. Use that letter to provide you with bullet points to put on that check sheet or that grid, to make sure that you have included all the screening requirements to make sure that you cover yourself. Okay. Documentation is really, really important. Okay, because even if there is a case of COVID-19 at your facility, people are going to be looking for that information. Well, who was here? Who did they have contact with? And that information is what you're going to have documented on that paperwork. Okay. All right. Let's move on to the next one. Limit entry. So yes, there was a list of people that are allowed to come into the child care facility, which includes parents, right? But the letter also states that parents must be required to pick up and drop off outside. Okay. I have the little picture here of the car rider line that I'm used to when I take my children to public school. You guys may not be used to that, but that's the scenario I'm going to use because that's the one I'm most familiar with. Okay. So remember that if you're doing this car rider drop off line, that the children can be signed in and out by the staff or the parent. Okay. So if you're going to use this method, remember that the parents don't have to get the clipboard to sign in and out. They can if you would want them to, but the minimum standard says that either the staff or parent can do that signage. Okay. So don't worry about breaking that rule. And then remember, again, you have to be really meticulous with documentation, because parents aren't walking the children in the building and taking them to their classrooms like they have previously done. You want to make sure that you are not losing track of these children, right? You don't want to be the one in the midst of all this stress and high chaos to lose track of a child. And now the regulatory service has to come out there. They don't want to come out there either, because we don't know who has COVID-19, right? So now there's an investigation open because there's a lack of supervision at your facility because you did not keep proper documentation. Don't let the stress of COVID cause you to fall short of meeting those standards, because you're still responsible for those on top of these additional restrictions. So don't forget that. Okay. The system that I pictured in my mind for this car rider drop off is to maybe have 2 or 3 teachers who are pretty good, pretty responsible to be in charge of the drop off line. And then you can have it set up to where one of the staff members can be in charge of taking temperature, right? So all they do is take the temperature. They can do it at the car while the child is still in the car, take the temperature, check it, make sure that it's correct. And in the meantime, while that staff member is checking the temperature, the other staff member can be going down the questionnaire sheet, the check sheet, the grid, to make sure that everything, that all the requirements that you're supposed to have before you enter the building, that they have met. So you have to ask those parents those questions about their children, about their family, if they've traveled, things like that, things that the children may not know or may not even want to talk about or tell you. So, and the reason why I think it's so important to make sure that you have the children in the car at the time is because if they come back with the fever, or that you can't check off all those boxes, then you can close the door. We'll try again tomorrow. They didn't meet the standard, they can't be in care. You can't, because of the temperature, or because you didn't meet all the requirements for the checklist. Okay. Oh, and then for a third teacher, that teacher can be at the door, so that once the child is dropped off and they've been checked out, the family's been checked out, the child is allowed to be in care. The other teacher gets them at the door. They have a hand sanitizer, hand cleaning station right there before they get to the classroom and are able to wash their hands. Okay, so I think that system will work really well. If you're trying a system like that, or if you tried a system that didn't work this week, maybe think about this other system over the weekend to see if maybe you can adjust your staffing and your scheduling to maybe set it up like this, and this may work better for you. No guarantee, but it may work better for you. Okay. Let's talk about the meal service. Meal service has to be individual. So I know that some facilities will do the family meals, where they'll have a big bowl of macaroni and cheese, and the children pass around the big bowl and kind of self-serve. You cannot do that during this time. Okay? If that's what they're used to, you have to make the adjustment. The teacher provides the entire completed filled plate and hands it to the children, so that they're not, maybe cross-contaminating, or if they are sick, spreading the germs amongst each other. Well, let's talk about additional preventative steps. We've heard about them all the time. I think all day long, the news is talking about something. Not to mention social media. We'll talk about that in a minute. There's always something where it's telling us what we can do to get past this, because we will get past it, right? One thing that you can do is sanitize your furniture, equipment, and toys often. Okay? All the time, more than you did before, right? Because you want to make sure that on a day-to-day, every single day, it's clean, it's sanitary, it's disinfected every single day, all day. You want to make sure that you cover, and that you require your parents, your children, to cover when they cough or sneeze. Really important. Sometimes you do have to tell grown-ups, cover when you cough and when you sneeze. I'm going to tell you the story just because I'm a storyteller. In line at Sam's, and just imagine how busy Sam's is, right? In line at Sam's to, try to pick up some things in bulk, because children will be at home much longer, right, after spring break. I'm standing behind this gentleman, and in the midst of me just standing there looking through my phone, I noticed him just turn to the side and just chew and just sneeze, just out in the atmosphere, just let it go. Hold on. And without even thinking, I just say, you gotta cover. You gotta cover it. And I wasn't rude, I wasn't disrespectful, because he was an older man, but I had to tell him real quick, this is not the environment to be just letting loose like that. You have to cover. And so because we continue to have a conversation while we're in line, kind of talking about the environment and what's going on, but hopefully he remembers that even though you're not sneezing on your own hand, you spreading your germs to everybody that you just sneezed in front of. And he was an adult. Hand washing, make sure you're hand washing diligently. Okay, make sure that this is the time to check to make sure that your staff and your children are hand washing properly. I've noticed that with my 5-year-old, I'm watching him with the hand washing, and I'm washing my hands with him a lot of times, just because I just want to double check to make sure that I've given him the proper procedures on how to wash hands. I find myself washing my hands longer just to make sure, right? So make sure that hand washing is happening. Stay home when you're sick. Okay. allow your staff to stay home when they're sick, right? You don't want to be in the environment, even if it's allergies, right? It's tricky because everybody don't sneeze too many times, don't cough too many times. You know, we seen what happened on the airplane, what's happening on airplanes when people are coughing and sneezing. So you want to make sure that if you're sick, just stay home. It just makes it better. It's less stressful, and you don't want anybody looking at you, you know, kind of sideways, like, oop, you know, they got the corona. You don't want that, right? So just try to steer clear if you have any kind of illness, and then use protection. Gloves, right? We talked about the sleeves for the thermometer, and then even like your teachers who may be working outside with the parents for drop off or to screen people to see if they can come in the building. Maybe they need a mask on, you know, for extra protection to make them feel more protected while they're out there. Okay, let's look at the chat. What do we have here? Let's see. Here's a question. Oh, someone said they would have lost it if he'd have sneezed. Well, I was nice. You know, I try not to, you know, lose it too much on people, you know. So here's a question we have here. Do you know if they're allowing us to mix the age groups of children if we are experiencing staff shortage? Okay, I'm gonna give my 2 cents, and I'm gonna let one of the experts, right, in the in the regulatory field step in. I don't know for sure, but I would assume that as long as you're following the ratios and the guidelines when you're mixing children, that you're fine. But I don't know if they've made any other exceptions. Any exceptions that have been made right now, Chioma, Shantae?
Not to my
Right now,
knowledge.
as long as the directors are making sure that they meet ratio in each classroom, then they will be okay. You also may have to go up to maximum group size if you have 2 staff that you can put together, because that'll change up your specified age group. So just make sure to follow the chart for ratio.
Mm. Okay, your hands up. That means you have another question. Okay, Dominique, you can come on. You can ask your question.
Okay, well, I guess, and that was answering my question, but I know like we have one larger space and say like we have a few, I know we have 4 staff members that'll be out next week. Either they already have weak immune systems that they have been having for years, or they are older women that meet a certain age range that they have been looking out for. And so, for example, like we have preschoolers that are like 4s, 5s, that are school age, and then we have our after schoolers, which are 6 through our 12. Now the classroom is big enough for us to divide it down the middle and separate them with their teachers in that space, to make sure that we are still in ratio. I just want to know that if that will be okay. And then again, like at nap time, our youngest age range is 13 months at our center, but I know that still is considered an infant. And so I just want to make sure that even when they're napping, and we're trying to relieve our teachers and give them breaks, that they could still be maybe in a classroom with the toddlers, just divided by furniture.
Okay.
Just so that I know what we need to have in a place for Monday when we open back.
Okay. For ages 13 to 17 months, let's say you have them mixed with toddlers before nap time. At nap time, you wouldn't be able to reduce staff in the space to meet the nap time ratio because that only starts at 18 months and up. So with them, you would have to send them back to your infant classroom so that you could have maximum group size in your infant room. Once they turn 18 months, you can have your you can have your 18 months to 3-year-olds if it's 2 separate classes before nap time. Then you want to, you can group those 2 classes together during nap time and have one teacher in there.
Okay, so good. So it sounds like you still would have to follow the standard, you know, the chart, and you know we can work on that to try to figure out the best option for you and your center. Once we're done with the webinar, if you'd like. Okay. All right. So I have another question. Where'd it go? Oh, I know 3 daycares that have already experienced the COVID-19. Hope it won't shut down the daycare. not sure exactly what you're asking. Maybe you're just giving us information. So, 3 daycare centers where someone has had or has been diagnosed with COVID or tested positive for it. Um, if you're asking, if you're stating that you hope they won't make all daycare centers close, it's tricky because I was a little surprised that they were open, although I guess I understand it because you have the parents that work, right? So you have nurses and doctors and people that have to be in that profession who need childcare. So it's tricky, but it is much like a school. So where a
Was
lot of
that COVID reported? Was that center reported, or those 3 centers that had the presumptive positive? Was that reported to licensing? Because I know
she
there's
can,
a survey out.
oh, it's not
Okay.
sure. Okay, so it appears that just maybe something that's been going around the industry, right? So we share information all the time. So I don't know. It changes from day to day. So that's one of the things that we have to keep an eye out for as well. Okay. The next slide is education. Okay. You want to make sure that you're well informed. Good segue, by the way, whoever is on the iPad. Good segue. Make sure that you're well informed about what's going on, right? Make sure that when you receive information that you verified, make sure that you send out helpful tips, maybe in a newsletter, or put on your parent handboard. Is it called a handboard? Parent board, to where you can give them the information as you receive it. You should at this point have notices at your facility as well. The notices should be indoors, outdoors. It does. I don't think it's tacky. I think it's important to let anybody know who may be visiting your facility that you're aware of what's going on and that you're on top of it. Okay. Practice social distancing as much as possible. Okay. You want to practice that as much as possible. I know it's harder in a classroom, but just pay close attention to make sure that they're not. It isn't business as usual, right? So as much as the 2 friends usually come in every day and hug, maybe you should explain to them what's going on. Figure out what you want to tell children, what kind of education you want to give them, so that they'll know it's not the time to hug your friends, right? It's not the time to kind of hang out on each other. It's time to kind of give each other a little more space. So you want to practice that as much as possible. And then stay up to date with all CDC requirements and HHSC requirements. HHS requirements, Health and Human Services. So that's who sent you the letter originally. So if you go to the website, there's at the top, I think there's a red or neon colored notice that says updates. So there's always, they're trying to keep you on top of the information to make sure that you know what's going on at the facility. Another thing, when giving out information, just make sure you verify it, right? And that's something I had to make sure that I did before I gave this webinar today. I want to make sure that anything I tell you has been verified, because we know social media has some stuff out there. They have hoax and scare tactics. There's a lot of stuff. I've been getting so many text messages and so many DMs about, did you hear this was going to happen? Did you hear this? Okay, let's focus on what has been reported and from CDC and HHS. They're going to make sure that you as a daycare facility, or you that are in this profession, are up to date with the information. Look to the state for that answer, and then look to CDC, and they'll give you information as well. Okay, so don't share information that hasn't been verified, because some people really panic about information that they're seeing on the internet. The next one is you want to be prepared. So preparedness is really important, and you want to stay prepared. Okay? Things may change at any second. Just as fast as COVID-19 came in here and coronavirus became a household name, it's going to fade out. Okay. I recently saw a list of the viruses that I've experienced in my lifetime, and some of them I didn't even remember. And I was like, oh yeah, I forgot about that. I forgot about that one. Soon we'll be like, I forgot about that one. Probably not in the near distant future, but at some point, we'll be like, oh, I forgot about that one. Okay. So things will change. This is a good time to review and update your emergency preparedness plan. Okay. Add something about a pandemic or a virus or something that can cause you to be in the situation that you're in now to your plan, because now you've experienced it. Now you have something to talk about. right? Think about what could have been in place, or what could you have had in place at your facility at this point that would have made it less stressful for you, and plan to do that. Just plan to have that in place, so just in case something like this happens again, you've experienced it, you made plans for it, and you're better prepared for it. You should also update handbooks, parent handbooks, teacher handbooks, because now you dealt with staff, and I've been hearing about some staffing issues, right? So you may want to update your staff handbook to include situations like this when there's a limited number of, when there's an outbreak of some sort, and there's some limitations that you may have, or some eeriness that you may feel. You want to make sure that your teachers are comfortable, they're confident in your decision making, right? They're confident that when you want them to come to work, even though the coronavirus is going on, that you have things set in place to make sure that they're safe while they're there. Okay, so make sure that you help. If the confidence isn't there, you probably see it right now, right? You're probably experiencing that right now. So you want to make sure that if you do have to go back and revamp and look at things, how you handle things, this is probably the best time to have that life lesson, and then you can go back to it and make sure that everybody's comfortable with the position that they're in. Everybody's comfortable with how things are flowing at the daycare. Okay. This is a good time also to check your enrollment forms and your employee files. The last thing you want to happen is for a child to become ill in care, or to get a temperature while they're there, and you go to call and no one answers the phone because the numbers have changed, right? So this is a good time to make sure that everything's up to date. Tell parents we're updating information so that they know to provide you with the most updated information today. Okay, same things for staff files. And you also want to collect emails and from your staff and your parents, because in the event that you do have quite a bit of children and quite a bit of staff who aren't there, when you get back to business as usual, you want to be able to contact them and let them know that things are back, and you want to tell them, give them notice or give them whatever information that you may have. These last two, you probably think I'm a little weird, but seriously, you have to plan for the worst and plan for the best. Well, what does that mean, Anitra? I'm glad you asked. Let me tell you. So for me, when I say plan for the worst, that means think about what thing could happen today that could be considered worse or horrible to you. Let's say you receive notice that a child that you had in care today has the coronavirus, right? To some of you, they'll be like, oh, that's a worst case scenario. Okay. Plan for that. What would you do? Write it down. Make a preparedness plan specifically for the worst case scenario happening and what you would do. But then I want you to think about the best case scenario. What would you do if, as fast as this thing came in, it goes away, and on Monday or Tuesday, it's back to business as usual? Do you have enough staff that are ready to come back to work to where all of your 100 children can come and return to school on Monday? It's good that it's over, and it's good that you can go back to business as usual, but have you planned for that? Are you prepared for that? Okay, so make sure that you take out time to prepare for that, because this will pass. What is the hashtag? Do it together, or something together, or something like that. Okay, so it's gonna pass. Things are gonna get better. You're gonna be back to where you were. Okay, plan for that, because it's gonna happen. Okay, so Shanta from licensing said the survey should be completed online and it's sent directly to licensing. If things change for your center, update licensing. Your inspector will be notified once you complete the survey. So there is a survey on the Health and Human Services website. You want to go in and complete that survey. I'm assuming it's a variety of questions that they're asking you related to your child care facility. Go ahead and fill that out, because you're on the ground, right? So you see everything, you experience everything. Relay that information back to them so that they can inform you how to proceed, right? So they need that from you guys. So I would suggest that everybody, once you get off of this webinar, go ahead and fill out the survey. Give them the information that they need. Were you going to say something, Chioma, or are you just fixing your camera?
Yes, I was going to say something. So that goes into my question regarding the 3 centers who have the reported COVID.
Oh, yes.
Those directors need to report that immediately if they have not already reported that, because we as an agency are reporting to the governor as it relates to our daycare centers. And if we're withholding that information, we are contributing to the spread. So please, the person who shared that information, please ensure that if it is factual, that those directors have notified their licensing inspectors and completed that survey, so that we know how to proceed as an agency.
Okay, good. You hear that? So it's important as the census is right now that everybody's talking about, right? Go fill out that survey. It's really important to give them a heads up onto what you of what you see when you're at the daycare center. Okay. You want to try to train or adjust your mindset to turn the chaos that's going on right now into a lesson. Whatever is the most chaotic to you, what can you do? What kind of lesson can you prepare to help the situation be stressful if you could go back and start over? If you can go back and start over to the day that they told us about the coronavirus, the thing that you were not prepared for, that chaos that you felt, the panic that you felt, what could have been in place at that time to help you today get through it? And you want to look at that because you can learn from every situation. Let's see, we got some more chats. Oh, they just said thank you. You're welcome. So 10 people rule doesn't. Oh, so the 10 people rule doesn't count in daycare. Great question, right? So that's what they're saying on the news. The governor, the mayor, at least the mayor here in Houston, has talked about the president too, has talked about this 10 people thing. So I see Chioma shaking her head no. So I'm assuming that because it's daycare, that rule hasn't been set, or they haven't said that's a rule for daycare. However,
no, it's not specific for children.
Okay, not specific to children. However, even in I try to be in certain chat groups and things on Facebook. And again, I'm assuming that this information is accurate and just not, something that they've heard. But one of the counties, like a smaller county, someone reported that they required their daycare centers to close because they're considered a small business. And just like the bars and the smaller establishments that were required to close, they were required to close their facilities. Don't know how true that was, but that's what they were saying. Again, I think that because daycare is so important, I don't know if that's going to happen across the board. I kind of doubt it, just because, like I said, our healthcare professionals, our firefighters, our ambulance, drivers, they all are directly affected by daycare. A lot of them have children in daycare, so I think they realize that it's a necessity. Okay. There. So one of the questions is, what do we do in the case of NCI not being open for a week now? Oh, so I guess I'm assuming it's affecting funding. I'm not sure. That's not really a standards thing. So you may have to refer back to workforce. You'll likely have to refer back to them to see how to proceed, because I think a lot of places are closing. A lot of things are being closed down. I would assume that if all possible, if you're able to continue care, I would say continue care, because you know that you'll get your funding, right? Because it's a government funding. I'm pretty confident that once they release everything and get back to business as usual, those monies will come. But you may have to just kind of make that decision on your own, because that's a tricky one when it comes to caring for children who you may not be getting paid for.
Hey, well, I was just going to tell her that the workforce sent out an email just specifying on what you need to do if it was regarding funds. They're asking that when your parents sign in, they hit option 3 to report them being at the center full time. And that way they will make the necessary changes or updates to their system.
Okay. All right, so check your email. Sounds like check your email, or Shantae even suggested checking the Workforce Solutions website for that information, because licensing has not been informed of anything like that at this point.
Okay, so I'm reading the Workforce Solution, email, and like I had a parent that was calling to make threats to me, talking about they're gonna take their kids out because I've not been opened, And, I didn't want to open up because, when they brought up the 10, the 10 people rules, I just decided to close because I didn't want to violate the, licensing rules, or, I didn't know what was going on. So, because this is my first time having my own child care,
Mm-hmm.
and I'm trying to be in compliance with everything that's going on.
Okay, and I think you're on the right track by trying to be in compliance and everything, but just like in this webinar that we talked about today, you don't have to close, so you can be open. So now that we've given you the framework and the tools, to go ahead and plan to open on Monday.
So I have some other friends who are in child care and consider
Mm-hmm.
closing as well. And that was the same guidance I gave before this webinar, was you don't have to close because daycare is an essential need. It's still an essential need. So just like Anitra stated, we still have people going to work. People are still going to work. I'm working. My daughter was here today, and I'm like, oh, she needs to go back to school on Monday because I still have to conduct business. So as a provider, still utilize the precautions that have been placed,
Mm-hmm.
and explain those precautions to your parents, and be open. Be open. This is not everybody needs to close.
Good, thank you. Your wording is so much better than mine. Anyway, so like I said, use the information that we provided you today. Go back to Health and Human Services website, print out that letter, develop everything that you need to develop so that when you open on Monday, you're prepared. Talk to your staff, talk to your parents, communicate. Communication is key. But do not open on Monday unless you're prepared to follow all these rules and all these guidelines. If you're not ready, don't open. Better safe than sorry. You don't want to open and have something happen. So again, you use your own judgment with that. I don't know how big your facility is, but like you said, parents are needing the service. So if you can provide the service, provide the service. If not, then they may end up going elsewhere. Okay. If you have any more questions, just type them in the comment section. But as I said, I want to do a series of webinars, or if you even call this a webinar, information sessions around this time, because I can't even go to daycare centers and do what I usually do right now. So I want to still be able to give you information, important information, especially in the environment that we're in right now, because the stress level is completely high. It's extremely high. So I want to be able to still be available to give you guys information. So if I do not have your email address, I'm going to put my email address in so you guys can contact me and let me know that you're interested in knowing any upcoming webinars that are information sessions that I may have, because I want to continue to be a support system to you guys during this time, so that we can set some things up, and maybe we can meet like this, next week, and maybe we can just discuss amongst ourselves how we can get through this with, as keeping children as healthy and safe as possible during this time. Okay. And I also would like to start this platform, because I kind of enjoy doing the Zoom video today. Start the platform to where we can discuss amongst ourselves, maybe without my licensing friends here, discuss amongst ourselves any grievances or any accomplishments. We can celebrate each other. We can kind of get through hard times, because I know in business there's always ups, highs and lows.
No, yeah, you say grievances. I'll be a part of the discussion. I can be on mute.
Oh, okay, but you want to hear them.
I can give a leadership response on how to overcome that battle that they may have with their inspector, because I do that a lot. So I can definitely provide that guidance.
Oh, good. So look, see, we're working on the next couple series of webinars here. All right, so I just want to thank you guys for showing up, to receive this information. I really hope that I gave you something to kind of make you feel just a little bit more confident when you go to work on Monday. Again, think about your past week. Were there some things that were hit? Were there some things that were missed? Revamp those things. Take this time to look back over those things. Think of new ways to do it. Think about some of the suggestions that I gave. Maybe you want to implement those that may help you next week. How about let's make next week better than this, and we are improving. We're progressing, right? Because again, I'm excited about helping you guys through it, helping us through this, because it affects me too in my business as well. But if nothing else, I'm done. I'm ready to go relax because it's Friday and we got through the week. So let's celebrate that. And until we meet again, all right? I really appreciate you guys for logging on, and you have a good one.